Good evening, and welcome to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by our co-host, nurse practitioner Hannah Raymond, and we are excited to welcome back to our studio tonight our colleague, Dr. Brian Cilley, infectious disease physician and internist, who actually, we all three of us work together. We hope everyone's having a great summer. Can't believe it's kind of near the second half of August here. We were both lamenting just about how quickly the summer has gone. We hope everyone out there is having a great summer. As always, we would love to hear where people are tuning in from and watching from, and also who is tuning in and watching, because we like to say hello. Tonight's topic, we will be discussing with Dr. Cilley tick-borne illnesses, including Lyme and some other common tick-borne illnesses unique to this area, but also some tick-borne illnesses that are in other parts of the country that sometimes we can see here to raise some awareness regarding some of the treatment options. And so if you have a tick question, please send it in, or and also, of course, if you have any general medical questions, Hannah and I, and if Brian feels up to it, can discuss some general medical questions as well. We usually reserve those to the end so we can stay on topic for a while, but we'll be happy to try to address those before the end of the show. So, with that, Brian, welcome back. Thank you very much.
Thank you so much for having me.
So, Lyme disease, and we were just talking, so it's a Northeast phenomenon for the most part. Is it unique for the most part to this area, is that right?
95% of cases of Lyme disease do occur in 14 states, and that's basically in the Northeast from the Mid-Atlantic to Maine, and then going west to the Great Lakes states. CDC says that there are about 30,000 cases a year that are documented, but estimates that we're missing probably about 2/3 of the cases that go under the radar, and may result in problems for some of those people down the line at later years, or maybe can get cleared up with antibiotics as a just normal kind of year antibiotics, possibly for like a sinus infection. Sometimes those actually clear cases of Lyme disease. But at this time of year, this is really when Lyme disease happens. From the time of the first frost to the first frost of the fall is when deer ticks are around. It's the Ixodes tick that transmits Lyme disease. And in the nymph phase is when they're the most dangerous and most likely to pass on Lyme disease. The nymph phase of a deer tick is tiny, only a couple of millimeters across. Whether they're engorged or not, they are really, really tiny. When they have been on a person's body for about 48 hours, they do blow up to twice the size that they start.
But still very small.
Yes, they go unnoticed in many cases. Half the cases of Lyme disease, they recall no rash and no tick being seen at any point in time. So it's great when people can say, yeah, I was just bitten by a tick and I have this big rash and I need to get treated. And I should say that that is the time that people should really present to their doctor and not see if the rash fades away on its own. It will fade away on its own, and it's not okay at that stage. Antibiotics do have to be administered, or otherwise Lyme disease can cause some serious complications.
In terms of preventing getting bitten in the first place, do you have any recommendations for people in terms of just like as a clothing, or is there any effective in terms of like bug sprays?
So where ticks live definitely involve the preventive strategies that I'm about to talk about. Deer ticks live at the edge of woods, tall grass, and very commonly in a coastal community like ours, in the tall beach grass that's around there.
Oh, wow.
So when people go walking their dogs, if they go into a field and they are wearing shorts and sneakers, there is a very high chance that you'll come in contact with either a dog tick or a deer tick. And the deer ticks have a high likelihood of passing on Lyme disease in this area. So how to prevent it? If you're on one of those walks, using off or another kind of similar product like Cut or something like that that contains the chemical DEET. That is one of the 2 chemicals recommended by the CDC to prevent ticks from getting on your body. There are some clothes that are made with permethrin embedded inside of them, and they have been shown to be effective at preventing ticks from getting onto, say, a permethrin embedded sock. But it's difficult to stock your entire wardrobe with permethrin embedded products. So DEET, I definitely think, is the best way to go. There are other products that haven't been looked at quite as closely from scientific studies as far as preventing tick exposures do.
Okay.
And what about, recognizing early if you do get a tick bite? So if you've seen the tick and it's implanted, what do you recommend people do next? And it is one of the small deer ticks.
In an area with Lyme in the general circulating tick population, the thing to do is if you think a tick may have had a chance to be on your body for more than 24 hours, say you're only noticing a tick after a camping trip that was over a weekend and you're noticing it 24 hours after you got back, then 200 milligrams of doxycycline given for a one-time dosage can prevent Lyme disease. I wanted to see if the CDC had any recommendations on this, whether it's still a very heavily recommended suggestion. And the answer is yes, in Lyme endemic areas, they do still recommend this from the CDC.
And we're in a Lyme endemic area,
absolutely,
as you said before.
Absolutely, so. All of the Northeast is. So if you have a deer tick on your body, and a deer tick is really kind of anything that is, say, less than half the size of a pinky nail. If you're getting to that size of a tick, then you're really probably, talking about a dog tick instead of a deer tick. The really tiny ones, the deer ticks, then yeah, a single dose of doxycycline can prevent Lyme disease if given within 72 hours of the tick removal. And
above a certain age, right? For children, we don't do that, right?
Tetracycline and doxycycline can miscolor children's teeth, so you don't want to give that to children with growing teeth, growing bones. Of course, I don't treat children at all, yes. But I think the CDC said 8 is the cutoff for giving doxycycline.
Okay. And not for pregnant women either.
Yeah. Correct. Yeah. Yes. So. Another kind of prevention kind of strategy, getting back to that one.
Yeah.
I have spoken with many patients who've had Lyme disease, and I ask them routinely at this point, do you give your pets tick prevention medications? And commonly I hear the answer no. It's really a way that you can prevent yourself getting sick. Because dogs and cats that are outdoors are closer to the ground. They'll pick up deer ticks even more than humans can.
Okay, great.
So we have a fever pitch of people tuning in, so thanks everyone for writing. A lot of people actually, we were trying to get our farthest reach, and I think this is it so far. Texarkana, Arkansas. So that's
wow.
Great. Have to worry about Lyme there? Not so much, right?
Not one of the 14
Not one of the 14
states.
Endemic states, but definitely keep listening. And then in Texas as well. So
there are ticks down there in the south, but the tick-borne diseases that we'd be talking about are a little bit different.
Right.
So we said we're going to get to Rocky Mountain spotted fever at one point.
Yeah.
So the ticks that you don't have to worry about here in this area, those kind of larger dog ticks, are the ones that transmit Rocky Mountain spotted fever. So the southeast is the greatest risk, but the southwest and northwest have spotty cases of Rocky Mountain spotted fever as well. This will make people acutely a lot more ill than any of the tick-borne illnesses that we have around here as a rule. Most people will get a rash, they will get fever, they will feel generally unwell. With Lyme disease, flu-like illness is a really common presentation, and that is like the flu-like illness times 2 plus a rash. It is a life-threatening illness that we luckily don't have to worry about here in the Northeast.
Right. Okay. Great.
Important though, if you've traveled to
did I say virus? I meant bacteria.
Bacteria.
I said virus.
Yeah.
Sorry.
It's okay.
Long day.
So just one more time, where you have to worry about the dog ticks and Rocky Mountain fever. So you said Texas, and what other states?
The southeast has the highest incidence.
Okay, so North Carolina, Florida too? Like, is it?
I'm going to say I think so.
Okay.
Yeah. And then we have another, somebody else watching in from Phoenix, Arizona.
Get out of here.
Yeah,
Really?
Wow.
Wow.
Yep. So anything comes to mind from there, but it's pretty warm.
So tick-borne relapsing fever, can present in that area. There's also Colorado tick fever. I don't know anything about them.
Yeah,
I'm so sorry that I'm going to have
No, that's
to,
okay. But it's important, I think, for people to know if
where
you
they
have,
live,
because Lyme disease, it's on our radar a lot here when people present to it, but when you're not in this area, it's not on the doctor's radars if you get sick. So if you travel to this area, if you have loved ones who travel to this area, then leave to go home, you know what I mean? If they get sick, make sure they tell people where they were, because it helps, you know what I mean? Like, it's not on, the forefront of maybe ER physicians or primary care doctors,
Here.
In like our, Arkansas or, kind of like in the western states, but It's funny, one of the doctors actually works in a building, Joe Costa. He was visiting someone in, I think it was Delaware, who presented with Bell's palsy, and and they were talking, there was this kind of clinical conundrum of what it was, and he said, talking to them, he's like, you sure it's not Lyme disease? Because, and sure enough, they didn't think of Lyme disease in Delaware, so they tested and made the diagnosis.
Speaking of, I'm so
no,
sorry.
so we have a question actually about some of the early symptoms of Lyme disease. So if you missed the tick and you don't know, you weren't aware that you were bitten, what would be some things to look for?
Excellent question. Headache, fatigue, body aches, both in the joints as well as in the muscles, and sometimes a what we call mononeuritis multiplex, which is where a motor nerve will not work or a sensory nerve will cause pain symptoms. Sometimes people have sciatic pain as one of the first symptoms, sometimes Bell's palsy, like we were just talking about, paralysis of one side of the facial muscles. Whenever Bell's palsy occurs in this area, we should be thinking about Lyme disease, and I hope that the emergency doctors have already gotten that in their minds. I believe they have. As far as other symptoms, some people will have chills and sweats, some people will have that rash. Mm-hmm. We think that a lot of people see the rash and then, just have the rash and don't see it, so therefore it's not one of the symptoms that they report. But what the rash is classically is not a bullseye.
Yeah,
the bullseye
phase
point is one phase of this rash, but only after part of it starts to fade. So I call it a palm slap rash, that if there is a big round area, and it really is about the size of a palm in some individuals, that is just sort of red with well-defined borders, looking like a just gigantic mosquito bite, that should prompt people to think, hey, I think I probably have Lyme disease.
Right. And what about the difference between, I get a lot of questions about an insect bite or a tick bite that has a little red ring around it. Now that is also not the bullseye rash that people think of classically.
Yeah. I don't know if there is a cutoff with when somebody says that this is definitely an erythema migrans rash, but I would say if it is more than 2 inches, 5 centimeters, that would be around the range where I'd say, yeah, this is starting to look more like a Lyme rash than just a local reaction from a bite.
To a bite, okay, great.
When do people know they're out of the kind of safe zone? Like they had a tick on them, maybe they pick it off, you know what I mean? And maybe they go to the doctor, but say they don't, you know what I mean, in terms of, or sometimes we see people in the office and say, oh, I got bit by a tick X number of days ago. What's the, the time frame between tick bite and if you got infected with Lyme?
The incubation period can be between 3 and 30 days. So if it has been 5 weeks since a camping trip and you're feeling pretty good, then that probably means that you didn't pick anything up during that time.
Okay.
So we have a lot of questions coming in about all different sorts of tick-borne illnesses, which we will certainly get to. Maybe we can stick to Lyme for right now and kind of see that one through.
Sure.
So there is a question about so the treatment of Lyme, but maybe we could talk a little bit first about how you diagnose it. So if somebody comes in with all those symptoms that you talked about, what do you do?
All right. Say somebody has that rash still on their body. A blood test is recommended basically just to rule out the other kinds of tick-borne illnesses in the area, and it should not be used as a test of whether the person does or does not need antibiotics. The person does need antibiotics even if their blood test is negative. One of the reasons for that is because the person probably will develop antibodies to Lyme disease, but our blood test checks for the response, the antibodies to Lyme disease, and if the person hasn't made that response yet, then they might be showing up so early in the presentation that the blood test is still negative.
So it's really more about the clinical presentation than the blood work at that point in time.
Yes.
Which is important for people to understand, because I think we kind of struggle with this in primary care, saying it's not so black and white as positive, negative in terms of the blood test.
And we're not checking for Lyme, we're checking for our body's reaction to the bacteria.
Right.
Correct. And those blood tests also don't give us a clear answer about whether somebody is cured or not from Lyme disease. They just give us an impression about what might be happening with their responses to Lyme disease before treatment and after treatment. Certainly, as far as what other ways we can diagnose Lyme disease, if there is a clinical picture that really kind of fits, like such as heart block, meningitis or a septic arthritis that really doesn't fit any other bacteria. The culture comes back as negative. These can be assumed to be Lyme disease, and Lyme disease treatment can be started even with a negative blood test. But generally, the blood test will become positive after about 1.5 weeks of symptoms.
Okay.
So if somebody's been saying that, yeah, I've had body aches and headaches for the past 3 to 4 weeks, I am convinced it's Lyme disease and their blood test is negative for Lyme disease, I do not think it could be Lyme disease. There is a scenario where the antibodies can fade away and Lyme disease can still be in a person's system, but we're talking more about duration of symptoms that are possibly going on for years and never really checked out for Lyme at any point. In that maybe somebody can make the case that the antibody levels decline slowly over time.
Okay.
Okay, great.
Oh, and you know what? One other kind of thing about Lyme disease blood tests. Sometimes, well, our lab here at Southcoast will go ahead and use a Western blot backup test to back up any positive tests. And some labs will only go ahead and do the screening test, the EIA test for Lyme disease. And patients with Lyme disease have complained that that leaves some people undiagnosed. Or people are told that they do not have chronic Lyme disease when if a few other blood tests get done, like the Western blot, which we do automatically, that might show further information.
Our labs do a good job in terms of testing for the Lyme, right? In terms of comparison.
I've come to really like the Imugen lab protocol for tick-borne infections. They also, on our tick panel, test for Babesia and Anaplasma, the two of the other kind of tick-borne diseases that are heavily in this area, and an additional test for Borrelia miyamotoi, which is a Borrelia PCR. Okay. So I think we should get into those, but I'm sorry, I'm kind of tangent.
No, it's hard. It's okay.
It's hard because it overlaps so much. So what about treatment for Lyme disease? If the clinical picture fits or the blood test fits, what's the initial treatment?
The best treatment is doxycycline if a person can take it. If a person is allergic to the tetracycline class of medications, amoxicillin works, and cephalosporin antibiotics like Ceftin or cefuroxime, those work as well. But the reason I like doxycycline more than those other ones is because, say, that tick is carrying around a second tick-borne infection like anaplasmosis, well, we wouldn't have to worry about it if the person's on doxycycline because doxycycline cures both Lyme and anaplasma. Whereas those other two, amoxicillin and Ceftin, they just don't do that. So I actually saw a patient recently meaning today, that was treated with Ceftin because the emergency room doctor didn't want to give them a medication that would potentially cause problems in sunlight, like doxycycline, which can cause a rash when people are on doxycycline if they get a lot of sun. She prescribed Ceftin, and he came to my office with anaplasmosis.
So what, it didn't cover for it?
Right, yeah, whereas if he was prescribed doxycycline from the get-go, then they would have taken care of both, and he probably wouldn't have gone to my office because it would have been doing just fine.
Doing fine. So how many preferred, if possible, for doxy?
Yeah.
Okay.
How many days to treatment?
That one is a bit controversial.
Yeah.
Some studies will say as little as 7 to 10 days with an erythema migrans rash, and that makes me very nervous. I see many cases of people coming in who've finished a course of antibiotics and for whatever reason their Lyme symptoms didn't go away fully, and I'm really convinced that shorter durations of therapy are associated with treatment failure. Although I am not a researcher, so I haven't gone and made a study like that, but I'm convinced that a bare minimum of 2 weeks of treatment when somebody's showing up with early Lyme disease is the right way to go. I would opt for 3 if I were a patient.
3 weeks, yeah, that's what we typically treat. And anything in the queue before I have a litany of questions I want to ask Brian?
You go, because I'm sorting it out. There's a lot of it's like rapid fire.
And then, so that's early Lyme, and then one of the frequent questions I get asked, like, does it go away after you get treated? Is the Lyme disease out of the person's system? Like, you know what I mean? Like, if you treat, what do you tell patients?
There are 2 reasons why people have symptoms of Lyme disease after successful antibiotic therapy. And I'm going to say successful antibiotic therapy because there's a third category of maybe somebody didn't really get cured with their prior treatments for Lyme disease. But for people that did get successful Lyme disease treatment, they could have damage being done, they could have had damage done to their body by the Lyme disease when the Lyme disease was still in their system. And you know what, I actually think my second scenario in there was the people who have ongoing symptoms that actually still have Lyme disease right there. So forget the third category.
Okay.
Sorry.
Yeah, that's okay.
And so say, tick on you, you get the rash, you have the flu-like symptoms, you start antibiotics. Do people really start feeling better like pretty quickly on the therapy in terms of like the flu-like symptoms and some of the, in your experience, like is like 24 to 48 hours, the symptoms start to recede, or can it ever get worse before it gets better? Sometimes we see that when treating certain infections.
I'm going to say that most people will feel a significant effect in the first week of antibiotics if they're being treated with early Lyme disease, but it's really the most dramatic with anaplasmosis that somebody who gets their first dose of treatment will feel 50% better after one pill.
Okay.
So it's not that dramatic with Lyme disease. It does respond slower than, say, anaplasmosis for comparison's sake.
Okay.
So later symptoms of Lyme disease, because we talked about early Lyme disease so far. Lyme disease can cause people to have effusive, meaning swollen joints with joint fluid. So somebody can have no knee injury, but then have their knee blow up over and over and over again. And if there's not a history of arthritis there, then their physician should be thinking about Lyme disease for that. Heart disease can happen, meningitis can happen, and with the heart disease that I'm talking about, I'm not talking about blocked arteries, but I'm talking about skipped beats, what we call heart block. So,
so an electrical...
The electrical system.
Yes, that would result in palpitations. It might result in retaining too much fluid, say in a person's legs. Not the most common reason that happens by a long shot, but it's one of those things that would go ahead and raise an eyebrow for, hey, maybe a person does have a tick-borne illness for these kinds of presentations.
And typically, is that untreated Lyme for what duration, or does it? When do those symptoms usually kind of show up if someone hasn't been treated?
Months to years.
Months to years. Okay.
Yeah.
Okay. Great. And then does it respond to treatment? Will those things improve with treatment?
Yes.
Okay.
But for the longer a person has Lyme disease in their system, they have a higher chance of having symptoms left behind once effective antibiotic therapy is given. So what kinds of things go ahead and leave people feeling ill after successful therapy? I call this post-Lyme syndrome. And people can feel run down. Like they said, I've had Lyme disease once and I never got my energy back. I unfortunately hear that particularly often, which is why preventing the initial tick bite is so important. And some people will have muscle aches similar to what we see for people with fibromyalgia.
Okay, there was a question about that actually just in the queue. Somebody saying that they had all the symptoms that you had, that we talked about, but we're told that they had fibromyalgia as well. So would you recommend kind of a specialist evaluation after that, or where would you recommend somebody go from there?
I recommend at least a Lyme Western blot test, which should be ordered, which could be ordered by a primary care physician's office. Our lab, while I love their protocol generally, if somebody has a negative Lyme test, I sometimes, if I really want to get a Lyme Western blot test, have to use a different lab like Quest Labs.
Gotcha. Okay.
Do you think we want to move into some other tick-borne illnesses, or anything else you want to talk about furthermore about Lyme?
I'm sure we're going to get some questions about that later on, so let's shift the topic over to the other two tick-borne infections that we see a lot in this area.
Sure.
Babesiosis is not like the other two infections that I'm going to talk about here. Babesia is a parasite that can be seen on a microscope of a blood smear. That is really similar to what tropical areas get with malaria. So malaria is transmitted by Aedes mosquitoes in tropical areas, whereas this is a tick-borne illness transmitted by the same ticks that pass on Lyme disease. And once somebody has a Babesia infection, they're likely to have sweats, chills, fatigue, headaches. They can have abdominal pain, particularly around the spleen on the left side, but sometimes around the liver on the right side. They can have a dry cough from blood vessels being clogged in the blood vessels of the lungs.
Are those symptoms similar to malaria?
They
sound exactly, right?
Very similar.
Yeah.
And actually under a microscope, it is a real challenge for pathology residents to tell the difference between malaria and Babesia.
Okay.
And
so you're sick pretty quickly.
Yes, yes. Some people, it's thought, might be able to clear Babesia infection on their own. Same thing with Anaplasma infection. However, it's impossible to know who's going to be the lucky ones that can go ahead and get rid of it on their own. We know that it causes more severe disease in the elderly, and probably the very young as well might have a worse course of illness with Babesia infection too. It's not treated with the same antibiotics that we use against Lyme disease. The most common treatment is atovaquone and azithromycin. Not necessarily the easiest to take,
or the cheapest.
Yes,
Yeah.
yes, people without insurance will be paying a little bit to go ahead and get that very necessary treatment if they do develop Babesia infection. And luckily, we don't see too many uninsured patients in this area, but I'm sure other areas that have problems with Babesia, which can extend all the way out to the Great Lakes, will have major issues with payment because of that exact problem.
And they have to be taken together to be effective, right? You can't just take one of the antibiotics.
Yeah, I don't know where the other doctors in this area got this from about giving a Z-Pak for Babesia infection, but I've seen a number of patients come in that way, just getting azithromycin alone, and both need to get given, and I don't think any expert has said otherwise. So that one can cause a very strange flu-like illness in the summertime. So generally, if somebody has a flu-like illness in the summertime, think about a tick-borne infection. Think about getting checked out by your primary care doctor.
We define like a flu-like illness: fevers, headaches, chills, body aches.
Body aches, feeling run down, yes, fever, chills, sweats. And on that topic, I'm going to shift over to anaplasmosis, the third tick-borne illness that we have in this area. This one does behave a lot like Lyme disease in that it is a spirally little bacteria that responds to doxycycline, can leave people with fever, chills, body aches, and vague symptoms. This one doesn't cause a rash like Lyme disease does typically, although when either Babesia or Anaplasma can really affect the bone marrow, then people can have a very low platelet count, cells that make clots. So tiny little broken blood vessels can show up in the skin for some people when they have a tick-borne illness, either with anaplasmosis or Babesia.
Okay, great. We have a question, like you said, back to Lyme disease. Where would somebody go for treatment for chronic Lyme or post-Lyme syndrome around this area? And is there any controversy around that diagnosis in itself?
Post-Lyme syndrome, I feel is a pretty well-accepted diagnosis. Chronic Lyme, though, I have to say that I want to break those that group
Separate
of people
them.
who say that they have chronic Lyme disease into two separate groups. One of the two groups being post-Lyme syndrome, and the other group being people that might still have ongoing Lyme disease that still requires treatment to get rid of.
Okay.
So I'm the kind of doctor that would go ahead and treat people with chronic Lyme disease, but there has to be something to really separate it from post-Lyme syndrome in terms of the lab testing, and that really does require a close examination of the blood tests that have happened and the prior treatments, the history of the present illness. Yeah. It's not an easy answer to tell somebody if they have a post-Lyme syndrome or ongoing Lyme disease. It can be very confusing even with all the right information.
Okay. And so we practice in the same office, so it's, in terms of the infectious disease doctors for Southcoast, it's yourself, and is there anybody else that treats
There are several in the Fall River area, but I don't know much about their outpatient practices. As far as treatment of post-Lyme syndrome, that doesn't really require an infectious disease doctor because it's no longer an infection that's the problem. It is pain symptoms, it is headaches, it is sleep symptoms, and I feel that a care team should be involved for those, not so much an infectious disease doctor who's really kind of trained in how to give antibiotics and cure infections.
Would there be a place for you in kind of making that, post-Lyme syndrome and then back
but I
to...
I do have to say that I've had a couple patients who've been frustrated that you're not recommending a specific diet for me, you're not recommending a yoga regimen for me, you're not recommending a particular meditation schedule, and my answer is no.
That would be more back in
infections.
In the primary care and care team.
Right.
Gotcha.
Right.
So you for the diagnosis and back.
That's
for,
correct.
Okay,
That's
gotcha.
correct.
Sorry, go ahead.
Questions, or are we doing okay?
And that kind of on that same line, Crystal's asking about your thoughts on integrative medicine and ozone therapy. If you've ever heard of, I've never heard of.
Those aren't interventions for active Lyme disease.
Okay, all right. So that would be like something for post. Okay, all right.
Do you see people infected with more than one tick-borne illness at more than one time? Because, like, in terms of, I feel like I've seen a couple, with Lyme and anaplasmosis, or Lyme and Babesia. Yeah, thank you.
Yeah, extremely frequently.
No kidding.
It's not unusual in the slightest.
Okay.
So we're all caught up in the queue here.
And treatment for babesiosis and anaplasmosis, is it about the same for Lyme, or is it shorter?
For anaplasmosis, it's shorter than Lyme infection. I generally recommend 3 weeks for Lyme infection, and I'm pretty sure that 2 weeks will go ahead and take care of pretty much every case of anaplasmosis.
Okay.
For Babesia infection, it's a 10-day course. But that said, I have seen some treatment failures in the past. I think it's a kind of insurance issue to ask for longer than the initial treatment that's recommended by the CDC. So I'm sticking with it, but I've had numerous patients that have had to come around for second and third.
Okay, so just kind of be conscious. The symptoms you should feel better, and if you're not, to kind of loop back in with your doctor.
Absolutely, absolutely.
Do you recommend confirmation that it's been treated? Like, do you need repeat testing after for Lyme disease or any of these illnesses to make sure it's gone? Do you ever get questions like that? Like, I had Lyme disease, I was treated, should I have to get tested again to make sure it's gone? Thoughts?
I think there's useful applications for the repeat test, but I wouldn't necessarily say that if a person feels better, that an unchanged Lyme test needs to be addressed with more antibiotics. I think that some people will go ahead and have the normal expected decline in their antibody levels after they get treated with Lyme disease, and for other people it might take months to years for those antibody levels to decline. As long as they're doing well, it's not a conundrum. It is a conundrum for the people who don't feel well after their Lyme treatment and their Lyme antibody levels haven't changed. Do they still have ongoing Lyme disease, or are they left with post-Lyme syndrome after their antibiotics? And while a lot of guidelines will say, if you've given the antibiotics, they have post-Lyme syndrome, period, I think it is much more nuanced than that, and I sometimes say I'm not sure based on this only mild decline or no decline of antibody levels and your ongoing symptoms despite adequate antibiotic therapy that your Lyme disease is gone. I'm not sure about it. It's sometimes better to go ahead with a course of antibiotic therapy and see where we get.
Okay, great. Go ahead.
No, it's okay.
We're good?
Yes, caught up.
Any other tick-borne illnesses that we'd like to talk about that you're seeing or that are kind of in the news?
Yeah, Borrelia miyamotoi is in the same genus as Borrelia, the one that causes Lyme disease, and essentially it sometimes doesn't cause the Lyme rash, but otherwise can act just like Lyme disease, and sometimes the blood test will not be as positive. We have a secondary blood test through our network called the Borrelia PCR that we throw into our regular tick panel nowadays. So if there's ever a question, could this patient have a Lyme-like illness caused by something that is like Lyme but not Borrelia burgdorferi, the classical Lyme bacteria, then that is one that can cause similar symptoms and has been increasing in the Northeast.
Okay.
And what's the treatment like? Was the treatment different for that?
No, it's identical to Lyme.
Okay, okay. So that's reassuring.
Yep. But it can be definitely a little more mysterious, and it can elude diagnosis for a little while.
Okay. What's the difference in presentation, if any?
Less common to see a rash, we think. And otherwise, very similar in presentation. Okay. Joint aches, muscle aches, headaches, feeling run down, feeling tired.
Any other tick-borne illnesses in this area that you see are worth noting?
In this area, I'm going to say no. There have been ticks that have been found on some of the outlying islands that test positive for Rocky Mountain spotted fever, yet cases do not seem to occur here in the Northeast. Clinical cases of Rocky Mountain spotted fever, we talked about the usual places. The Southeast is much more common. And I do wonder if that might change in time, but knock on wood,
right now.
that we have not seen cases up here.
Is the prevalence and the incidence of Lyme disease and tick-borne illnesses kind of static, or is it increasing? I feel like we've been practicing 9 years, and I feel like there's more. But maybe is that something that maybe is just my arbitrary, or are we seeing more of these?
I think it depends on how far you step back. As far as Lyme disease, the incidence of Lyme disease in 1971 was 0. Now we're talking about 30 to 300,000 cases a year. So certainly that has increased. Babesia cases were not recognized as a clinical disease, I think, until the late 80s. So certainly there's something happening that tick-borne diseases have become more frequent as the decades go by. And some say it's crowding of environments, getting into smaller forests, then pushing the deer population that the deer ticks go for, or possibly the white-footed mouse, which is the usual vector of the Ixodes nymph, which is the deer tick's nymph, the one that passes on Lyme disease. There might have been something different about the way that they travel around, or increasing populations of mice. There is a big experiment being tried on Martha's Vineyard, I think. I might be confused, it might be Nantucket.
I think it's Nantucket, yeah.
Okay.
Yeah.
That they're trying to control the mice population in hopes that they might be able to get rid of the tick-borne illnesses that happen there.
Wow.
Oh, wow.
A good little microcosm there, an island.
Yeah, if that works there, it might have major implications for the mainland.
For the whole area. So just a follow-up question on the post-Lyme syndrome from Crystal, asking, are you aware of any support panels or resources for providers in the area for patients that have post-Lyme syndrome? Or would it just be kind of based on people's symptoms, what the most bothersome symptoms?
Advisory panels. I have done research on my own, but I do not know if there are panels that are around.
Okay, okay. So it would be something to ask we could look into it further in primary care.
Yeah, I'd have that discussion with primary care,
Sure.
and I think that they could look into it as well.
Okay, great.
But I have a suggestion really for somebody with post-Lyme syndrome, which is really start looking into some of the things that work for fibromyalgia patients, because the symptoms are so similar that I think there might actually be a overlapping cause of both of these. A lack of restful sleep has been thought to cause fibromyalgia symptoms, so therefore restoring a steady amount of REM sleep at night, possibly with a medication like Elavil to go ahead and give them a deeper sleep, might go ahead and take care of some of those fibromyalgia-like symptoms for people with fibromyalgia, and might even help people with post-Lyme syndrome because the symptoms are so similar.
Similar. Great, that's great advice.
Do the elderly typically present sicker than younger people with Lyme? You know, in certain illnesses, the elderly present a little bit differently. Sometimes they can present like with a little bit not as subtle symptoms or not as severe symptoms, but is there a range in, because we're not going to talk about children, but so as older adults, like do they present typically, or for those of us who care for elderly people, what's your experience?
With Lyme disease, not necessarily. I've seen very severe cases of Lyme disease in young individuals, but with Babesia, it's a solid yes that the case mortality rate is much worse for people in their 80s who get infected with Babesia than it is for somebody in their 20s. Okay.
And then in terms of like looking for, so after the first frost, typically our suspicion for these tick-borne illnesses kind of fades away. Is that about accurate?
Some say second frost, but I do think that it's a lot less likely after just the frosting period that people can let their guard down a little bit and be a little bit less worried about ticks. But I've had some patients showing up in strange months pulling ticks off their bodies. I think it was late February of this year that a patient showed up with a deer tick that needed to be removed from his body. And I was like, this is just too early.
Yeah.
But it was there.
Late, yeah.
It was there. I don't know how it got there, but it was there.
Yeah.
So in like December and January, flu-like symptoms are most likely the flu.
The flu, yeah.
Yeah.
And best way to remove a tick that you tell people?
So grabbing it by the base, and some people will say, no, there's a much better way to do that. You need one of those tick removal kits that kind of lift them from the mouth. But if you get one of those tick removal kits, that works great. And if you don't have one, grabbing it by the base with a set of tweezers as close to the base as possible, because yes, their mouths are fragile. They can break as you pull it out. And if some of the tick gets left behind, it's not the worst thing in the world. However, because the body will sort of wall it off and kind of create scar tissue around it. But if that tick was infected with Lyme disease, the chances of passing on Lyme disease are probably higher if that mouth part hangs around in your system.
So you get the tick, but it breaks off. Is still a chance.
Yeah, and then usually washing the area pretty good with water to kind of help, right?
Yes. Yeah.
And then that would be a case to come see if we could get the prophylactic dose as well.
Yes. Yep.
Great.
No more questions as of now. We've had a comment. Somebody said that you're their primary physician and they love you, so that's good.
Thank you.
We knew that already. And let's see, a question from Robin just came in saying that she had a tick bite back in June and has no symptoms, but now she has aching joints. Is this something that should be concerned with?
So you do have symptoms. Yeah. I would recommend a Lyme disease test. Yeah.
And it might be a long enough time that it would be positive, truly positive.
It's certainly long enough.
Yeah.
Yes,
Yeah.
certainly.
Yeah.
Yes.
Yeah. So yes, Robin.
Get checked out.
Yeah. I think we talked about, a couple of other illnesses in the area that were a little bit more obscure than Lyme disease that maybe you wanted to touch on.
Okay, so yeah, I think it's tularemia that we were talking about right before the show started. This is what's called a zoonosis, and that it's transmitted by animals that are more exotic. Hunters will be more likely to be exposed to this kind of illness, or people who clean animal pelts. That if there is a tick or a flea that ends up going from this one animal that might be infected with this kind of bacteria called Francisella tularensis and bites a person's hand, they might get a ulcer at that site. They might have swollen glands up the arm. They might have fevers, chills, and tularemia has been found in all 50 states, I believe, maybe with the one exception maybe of Alaska.
Okay.
While we have you here too, just an important, I think we want to get out much more common bites. Cat and dog bites. I mean, we've talked about this a lot, right? A cat bite can be significant. It can cause a lot of trauma, right? Especially kitten bites, or anything. In people should take those seriously, correct?
Puncture injuries can go very deep, and they can create very tricky infections when they do go into a bone or joint. You will need oral antibiotics after getting a bite by a cat. It brings me around actually to go down a little bit of a tangent of another kind of bacterial infection transmitted by cats, which can be confused for Lyme disease, often cat scratch disease.
Yeah, perfect.
Bartonella henselae. That can cause another kind of similar kind of flu-like illness of fatigue, feeling run down, feeling achy, having chills, sweats, but generally also with swollen glands. This does not generally happen after a cat scratch. It can happen after a flea bite, and does generally involve being bitten by a flea of a infected animal. So veterinary assistants, people working at pounds, they're at a higher risk of getting that kind of syndrome.
And dog bites as well, also, right? Often antibiotics is depending on the severity of it, and also tetanus shots to make sure that you're up to date with tetanus vaccine, correct?
Absolutely. Yep.
Do you give prophylactic antibiotics for cat or dog bites before it's kind of presented itself as an infection?
Yes.
Yes. Okay.
Yeah,
So that would be if somebody got a bite, got a scratch, or should come in and be seen.
Scratch.
Or scratch not as much.
Scratch not as much, but puncture injury without a doubt. And if somebody's not penicillin allergic, augmentin covers the main kind of bacteria that we're really kind of thinking about, which is Pasteurella multicida and Capnocytophaga. If somebody's penicillin allergic, then we have to generally look it up because it's a little more tricky. I have to look it up.
It is a little more tricky, yeah.
I think we just looked that up the other day. So, and why puncture wounds? Why are they so tricky to treat?
It is the fact that the bacteria live at the very tip of the tooth of the animal, and that is kind of the tip of where the infection can go.
Okay.
So if it hit, say, the outside of a joint capsule, that might be enough to infect that joint.
Okay, great. So a lot to worry about there.
Yeah.
Good.
Yeah.
We have a lot of patients who work in the fishermen, marine industry, saltwater, things like that. Are they, in terms of like skin wounds and infections? I think you've helped me with this a couple times with patients. They're at a slightly different risk because there are certain organisms that can be more kind of water-based or marine-based, right?
There are some infections that generally happen to people who are exposed to contaminated fresh water, and some that are from salt water. And in this area, we're seeing both. I have, for instance, a patient who I had to treat for what's called fish tank granuloma, which is a mycobacterial infection, a really slow-moving infection that requires multiple antibiotics to cure. That caused bumps up and down the arm after she was cleaning a fish tank. I think it was at an aquarium. And then No, that's not right. I forgot where she was. But Buttonwood Zoo. Yeah, it was something at like like one of the zoo displays that she was like cleaning that and ended up getting a cut, and then ended up having like these nodules down the arm. And fascinating case. But then for people with saltwater exposures, then we worry about Pseudomonas, Aeromonas. And Vibrio infections, and they require different kinds of antibiotics. So if things are not responding to the first course of antibiotics with any kind of exotic story behind the way that the wound happened, probably get an infectious disease doctor to look at the case is a good idea.
And I think that's important too for just kind of general public service announcements, kind of the mechanism of injury and where you were and what you were doing. Not only location, but if there was water involved, fresh water is always an important part of the story.
History matters. Yeah. Not all these bacteria live everywhere.
Right, right. So we have a question from Pat about Lyme disease again, kind of a little bit more specific, saying that he was diagnosed years ago and wondering if a Lyme disease can cause a lymphocytosis. So that would be kind of an elevation, for people who don't know, an elevation in one of the types of white blood cells in the body. And it's kind of that's a hard question with, without the rest of the story, but.
Yeah, I'm gonna say that I don't think it's well described.
Okay, okay. So probably look for another cause.
I'd look for alternate causes. I'd look for alternate causes.
Yeah. Okay.
Anaplasmosis you can see, right, and elevated in the lymphocyte count. Is that?
Sure. I mean, at the time.
At the time of diagnosis,
but
right?
Not years
It's one of the differentiating things, in terms of liver enzymes elevations and.
Yeah. So the most common kind of labs we see with that are a drop in the white blood cell count, a drop in the platelet count, and a elevation of liver function test with anaplasmosis.
Yeah. Good.
We're all caught up here.
Fantastic.
Can you think of any other exotic diseases?
I think we covered all of them. Do we miss anything regarding the tick-borne ones too? I just want to make sure. I don't think we did.
So there are, one of the most common reasons that people show up with a fever from Africa after going on a safari is a African tick-borne fever, viral illness. Requires no antibiotics, but certainly will have a lot of people very concerned once somebody shows up with a febrile illness coming right home from safari in Kenya. So that is a short-lived illness that doesn't take up too much time before it resolves on its own. I want to say 1 to 2 weeks, but can leave people with high spiking fevers and being very scared about it.
I would imagine that is a terrifying scenario to come home from Africa and then develop a high fever.
There's not even a blood test for it, so in that time we're worrying about malaria like crazy. We're worrying about sleeping sickness and things we barely even have blood tests for. That's one of those tick-borne illnesses that are common. Europe, they have Lyme disease. Not nearly as common as we have it over here, and typically in more forested areas of Eastern Europe. Babesia infection is in some parts of Western Europe. I'm not solid on which areas, and it's not as common as it is in the northeast of America or in the Great Lakes area either.
Great.
So for people traveling there.
Oh, and Mediterranean spotted fever acts just like Rocky Mountain spotted fever, but not quite as severe.
Not quite as severe. So for people traveling outside of the country, not us, we're stuck here, but that's that's okay.
One other thing from what's here in America is there is a tick-borne illness that causes a rash that looks just like Lyme disease's erythema migrans, the slapped palm rash that I'm talking about. Only it's transmitted by a different kind of tick, and generally somewhere between Texas and Ohio, in that kind of middle of the country stripe.
Okay.
And that one is called STARI, Southern Tick Associated Rash Illness.
Oh yeah.
And I had one patient who I thought had that, gave antibiotics for it, just similar to Lyme disease, and I don't know if it's a success story or not.
Okay. But our patient, or our guest from Texarkana, just to kind of keep an eye out for that.
That's right.
Yes,
that's right. Keep an eye out
that's
for
the
that.
right area for that, yes.
Yeah. So Crystal says that you should start a Lyme disease clinic and get the whole team together. So.
We see plenty of cases of Lyme disease.
Yeah, I think you might already be doing that.
Yeah. For people who are watching, though, we can say if you do have questions about kind of infectious disease or infections that you do see patients, for consultation in our office. That you welcome that.
And it is a referral basis, so it would be a referral from the primary care's office.
Yes.
Yeah.
Yes.
Great. Thank you very much for taking an hour out of your busy summer to answer questions.
All right, thank you so much. Are we about to?
We're done. I
Yeah,
think
we're
I think
done.
we are.
Yeah.
I think we made it the hour. So
Decent.
yeah.
Sorry.
Any further questions in the queue?
No, that's it.
Awesome. Thank you very much for everyone who's tuned in from all across the United States. It's pretty exciting. Thank you for the people who submitted questions. Thank you, Hannah, Brian, Josh, our esteemed producer. Stay healthy, Southcoast. We'll see you next week.
I had 2 blockages. I had to have a catheterization and told me that we needed to see a surgeon as soon as possible. Dr. G made me feel like I was his only person that he ever did surgery on. You don't have to go to Boston. You can come right here to Southcoast and get the best treatment. I said to him, Dr. G, I guess I'm going to fall in love with you. He says, I know I'm going to touch your heart.